Good evening.
Evening.
How are you?
I'm alright, and you?
I am very well, thank you. You look very ready. Honestly.
I am ready.
Right. How was your day?
It was okay.
Mm-hmm.
Yeah,
You
busy
didn't go
but
to
manageable. No, I was working.
you're not on
Yeah.
call, are you?
Eh?
You're not on call, are you?
No, I wouldn't. I wouldn't be here. If I'm on call, I would be at the hospital.
Right?
Yeah.
Oh, okay. Do you cook there?
Do I cook?
Yes, or maybe doctors get special treatment, save
Ah, from
life.
where?
I don't know. I don't know.
From where?
I don't know.
Yeah, I cook.
Oh, you do cook.
Yeah.
Oh, well, that's good. I actually have an interesting question for you, eh? But
Hmm.
before, may you please pronounce your surname for me? I just wanna like ensure that I have the right pronunciation in my brain.
It's called Gamnca.
Oh, Gamnca.
Yes.
Okay, Gamnca.
Yes.
Okay,
Gamnca.
Gamnca. Not Gam. Gamnca.
Uh-uh.
Okay,
Gamnca.
like softly so. Okay,
Yes.
Gamnca. Okay, well, that's good.
Not
And what's
Gamma, Gamnca.
Gamma? No, yeah, I got it. I got it. I just are you closer?
Yes, I'm Kosa.
Okay. How many languages can you speak?
Only two, Kosa and
Yeah.
English.
Really?
Yeah. A bit of Afrikaans, but my Afrikaans is niet lekker.
uh, so
Yeah.
it's basically three. You don't have to be that fluent,
Mm.
right? Right.
Yeah.
So like I said, I have an interesting question for you.
Mm.
Why do doctors hate apples?
I don't know. I've also lost interest in apples.
No way. No way. You know.
I don't know. I didn't even know that's a thing. Doctors hate apples.
Yes.
Really? Who said so?
I've watched a lot of videos about that. Like they show them an apple, they just like change their face. I mean, they run away, they give you this reaction. I don't know. Or maybe it's just a thing, not really that they hate them. Do you eat apples?
I do eat apples. Yeah. But I think it's from that thing that says an apple a day keeps a doctor awake. We don't want to be awake.
Oh,
We've worked enough. Give us a break.
right.
Maybe it
So,
comes from that.
right. So,
Yeah.
Dr. Gamma, right?
Yes.
What do you do when somebody or a patient, let me say a patient, loses their life in your hands, knowing that you have tried your best to save them? Do you cry on the spot or you just keep it professional? Does it trigger you sometimes when you help
Mm.
the patients?
So, yeah, I think a lot of people actually don't realize that from medical school, you
Mm,
actually get a lot of exposure before you actually start working. So
mm.
it's not like when you now qualified as a doctor, then everything becomes new. It's just
Oh,
that when you, yeah, I think a lot of people are not aware about that because they were like, how do you feel opening up a patient doing a
mm,
surgery, or how do you feel when a patient passes away and all of that? So I think most of people are not aware, but
mm,
I'm from UCT. So basically medicine is 6 years, and
mm,
then the first 3 years are your preclinical, which
mm,
basically focuses on theory. You get taught a lot of teaching and all of that.
mm,
Then fourth year to sixth year is your clinical years. Then
mm,
that's where now you get the clinical exposure. You get now to be in the hospitals, in the clinics, and then you start to actually interact with patients, take history, and obviously everything that you do is supervised. So from fourth year to sixth year, and then the level of exposure increases as the years goes by. That's when you actually get to start to interact with patients, and you also get to like be part of the clinical team, even though you're not like an official doctor. So your exposure to death begins there, unless in all your medical school years you were lucky and no one passed away. So it begins there, and then before you even go to the clinical setting, we get taught on how to break bad news, how to, for example, in second year we do a course called, first year we did a course called becoming a professional, then second year becoming a health professional. So you get taught a lot and be prepared for when it actually happens. But yeah, what happens is that when a patient passes away, you're actually never alone, just by yourself. When it happens, you don't cry on the spot. No matter how much, you love that patient, you must hold yourself. But if you feel like, yeah, this one really traumatized you, what you advise is that you can, take yourself away from the moment, and there must be someone though that is there, and you must just call for help and say you're not coping, you just need a break, and someone can come and like take over. But then you must come back and literally pamper yourself, and then do everything that needs to be done, which is breaking the bad news to the family if the family is there, and also writing the official documents. So for me personally, how I handle it, I think I've grown in the professionalism and being a professional. So I don't cry on the spot. Yeah, I must keep a serious face. And then there
Yeah.
are those cases where, yeah, I think, one of my first, like, if you're doing, I don't want to jump around, but like if you're doing medicine, what we also must understand, there are different departments. So there's surgery, there's internal medicine, there's peds and all of that. And then there's internal medicine. Internal medicine is where the amount of death that you get to see is a lot. You see death on a daily basis. I know
I,
it sounds odd, but it happens because most of them are people with chronic illnesses and all of that. So you get to do death notifications and all of those things. So I think my first experience that was traumatic was when I was a student, and it was a neonatal death. So the baby was just born, and
yes.
then the baby wasn't breathing, and we had to recess, and then we do the recess, give oxygen, we do compressions, but then the baby just did not make it. So I
So
think that
sorry.
was my first traumatic one.
So don't you like sometimes feel like maybe I'm not doing enough, or does it like sometimes happen on like consecutive events and
Mm,
make you feel like, you know what, I'm not doing enough, or maybe I'm
mm.
like not doing enough as a doctor?
I think for me, it has never come to that point
Happening
because,
on
yeah,
okay.
because especially we do what is called CPR.
Mm,
So when a patient arrests, basically now there's no heart rate, there's no breathing. The first thing we start is CPR. That's
mm,
when now we all go in, and you there by the chest, and
mm,
someone else is giving oxygen and all of that. And even the way we do that, it's a structured process of what you must do next. You must give oxygen, you
mm.
must bag, you must do drugs, you must give drugs and all of that. And there's always a senior. You're never alone. Then the seniors called, they also do a blood gas, which is like quick blood test that is done to check if there's anything that we can correct. So we look at that before we even say this is a failed recess. We've tried all that we could. So I've never gotten to a point where I'm like, I feel like I failed. because even if it's a patient that has been in hospital, we do counsel family members if we say there is a poor prognosis that because of the disease complication or whatever it is, it's gonna lead to death. So I think it also goes back to that saying that people say doctors saves lives, which is also like, not really. So
But
I think
you do. I also believe that.
really,
I also believe that doctors, no, yeah, doctors save lives,
mm,
and yeah, I always believe that doctors save lives.
mm,
Ish, I want to understand something. What if it's a child? Like
yeah, I
you
think that's
start,
where my soft spot is.
yeah,
Children. Ah,
or maybe it's a teenager. Like they start
mm,
telling you about their dreams. You spend like 6 months or a year with them. You know,
mm,
you start having that bond. They drive that to a feeling where you end up thinking, you know what, this is a friend, or maybe it feels like it's a family member. So when you lose them,
yeah.
what happens? Like when they lose their life, what happens?
Yeah. So I think it does affect you. It
Mm,
really does affect you, especially if it's been like a patient that you've been
mm,
managing or you had like hopes. Like for
mm,
example, I'll always go back to this one that traumatized me.
mm.
It was because initially we did the recess and then there was no heart rate, no breathing and everything. And then we
Uh,
continued. We like, come on, compressions, give oxygen. And then there was a heart rate. You know, when there's a heart rate, you're like, okay, we're doing
mm.
something here. And then we're like, okay, let's continue. And then
Sorry, so it does happen in real life because
it
I've watched
happens
a
in
movie
real
about
life.
that. Oh, oh, so it does happen in real life because I always watch movies about them. Like, oh, okay, so it does happen. It's interesting to know that it happens in real life.
Yeah, it does happen in real
Mm.
life. Then as we continued, then the heart rate was just gone again. So
Ish.
now I was like, oh no, come on, baby. Come on. Come on, your heart was beating now.
Mm,
And yeah, so I think for me, what I've managed to like be good at is being professional. I never
mm,
cry on the spot, not at all. And then what happens is that if I feel like it was really traumatic, I can take like a few minutes, maybe
mm,
speak to a friend, speak to like a colleague and
mm,
cry if it has led to that. And
mm.
then, yeah, at that moment, speak to someone. And then after a few minutes, unfortunately, if you had a bad recess, that's not a call for you to go home. If you're on a 24-hour shift, you're going to wipe those tears and then you must continue working. And I think also what helped me personally is that I must, what I also do is that I speak to close people. I'm also a Christian. So I
Mm.
also believe
Oh,
in prayer and be like, yeah, this didn't go well. And there are those times where even though you've prayed and you've spoken to people about it, you still think about what happened and all of that. So it's a matter of also processing and also reflecting on, yeah, you do think as well on what could have gone wrong as well. Yeah, for if a research fails, there is
mm,
what we call a debriefing session.
mm,
It's supposed to happen, but because of how the hospitals are so busy, it doesn't always happen. So I
mm,
think my debriefing always happens after work when now I'm home and I'm actually thinking about what happened. And then I speak to like my friends or my pastor, and then we pray about it. And yeah, and also speaking to colleagues as well helps because they were also there. Then you also get to hear that some also felt the same way. Some were also hurt by
mm.
what happened and the fact that it was a failed recess. So going back to what I said of doctors saving lives, also it comes with a but. I think you must also give yourself the grace that you save lives to some extent because it's
It's
not
not.
always like
It's
you and
so.
then people get back to life. So I think for me, it's always, yeah, I think giving yourself that grace, knowing that you've tried the best you
Mm.
could. Like I said before, we call a resus a failed resus. We had tried all we could. We took blood tests to see what could be corrected. Were the electrolyte levels low? Did we have to give other things beside the oxygen and beside doing the compressions and all of that. So you do look at what could be corrected. But then unfortunately, if death had to occur, then it happens. Yeah.
So as much as you think that not really know everything, but know enough to save someone's life, you must always
Yeah,
remember that
no, you must
God
definitely know enough. Yeah.
enough, but you must also remember that God decides at the end of the day.
Yes. Yeah. I
Right.
think give yourself that liberty and
Yeah.
grace that you did what you could and what you knew. So you must have the knowledge. Yeah.
Oh, interesting. Right. So now
Yeah.
I have a lot of questions for you, but we'll get there. So now, please give us a summary of your educational background, starting from high school and the transition from high school to university.
Okay, so I'm from Cape Town. I was
Mm.
born and bred in Cape Town. I
Nice.
did, yeah. I did my primary school a bit in the Eastern Cape, but I don't
Mm.
remember much because I did like from crèche to grade one, no, grade three, standard one, grade
Mm.
three. Then I moved back to Cape Town, and then I've been there, did
Wait,
my full,
wait, sorry, wait,
did
sorry,
my, yeah.
sorry. Why?
Why?
Why? You can't say standard one. No way. You didn't
Yeah,
do it,
because we called it one. Because I remember I was doing one when I left Eastern Cape.
but it wasn't. It wasn't standard one. No way. You're not that
I
old.
think in the Eastern Cape they called it like that. They would say you
What?
are in grade R, and then they would say you are doing UA, which is like grade one at that
But
time.
you you didn't do standards and all that. It was
I did grade three. I did grade three.
right.
I was just trying to recall, yes. Then from primary till high school and university, I was in Cape Town. So I did my primary in Langa. I'm from Langa in Cape Town. Primary school called Zimasa Primary School, and it ended in grade nine. I think it still does. So my high school years were grade 10 to 12, and then I did my high school years
Mm.
in Tukai at the Cape Academy of Maths, Science, and Technology. Yeah, someone is saying, "Hey, well, grade three is one."
Yeah, but then you are hey, no way. And you used caps, right? You didn't use what is this? Did you use Bantu education or is
No, 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 no.
oh
No. Grade three. Let's agree with Buven. Let's not confuse people. Grade three. Yeah. Yes. So I did my high school in Tukai, Cape Academy of Maths, Science and Technology. And that was 3 years, grade 10 to 12, because my primary ended in grade nine. Yes.
Mm.
Then after that, I moved to UCT, and that's where I studied medicine. And yeah, and now I am officially, after long years, I'm officially now a doctor and
A
working.
qualified doctor. Congratulations.
Yes, thank you.
So um what really inspired, but before you tell us about this,
Mm,
how transition actually, how did you actually get to settle with that, allow it to
mm,
think in that, you know what, I'm no longer a high school student, I am a university
mm.
student now. So did that have any negative impact on you, or maybe you were just like, you know what, I'm ready for this, you would like sometimes visit the university, or maybe it had a negative impact on you? Did you sometimes wish to go back to high school?
No.
Okay.
I feel like when I'm done with the phase, I'm done.
Mm.
I'm like, let's move on. Because
Let's
even
move.
now, I'm like, I don't miss being a student.
Really?
No.
So right. So like, how was the transition? How did that treat you?
So it's one of the things that I'm going to speak about in
Mm.
one of the challenges. There's a question about challenges that's coming.
Mm.
So I was used, well, not used, but I was familiar with the UCT because
Mm.
when I was part of Cape Academy, the high school that I went to, we had what we call Maths Olympiads.
Okay. Sorry.
So
Sorry. So the Cape Academy, is it like a high school for everyone, or you need to qualify for that? They check your math and science marks, or it's just like for everyone?
yeah, they do check because
Mm.
also if you fail in the school, they kick you out.
Woo! Wow. Okay. So you
I don't
need
know
to
if
work
it's
hard.
still the case, but that
Mm.
it's a special school, and I'm
Mm.
actually grateful to my dad for that because he's the one who placed me at that school. I don't know about it.
No, that's
Um,
wonderful.
yeah, so it's a
He's a
math.
good dad. He's a good dad. You must buy him something. You're a qualified doctor now.
Nah.
Yeah, honestly. Yeah.
Yeah, so it's a maths, science, and technology school. So
Mm.
everyone there does pure maths, and then everyone does physics,
Mm.
and then you choose between IT or CAT, the
Mm.
technology part, and
Mm.
then there's also life science or accounting, and then your home languages. So that was the school. So it's a school that's focused on maths, focused on science, like it's solely focused on that, and then you must get good grades and all of that. So I was part of the maths Olympiads that we had, which is like basically yeah, maths was my favorite subject in high school. I really enjoyed maths. So I was doing AP maths as well, which is advanced programming in maths. And then I was also part of
Oh,
the then I was also part of the Olympiads. So the
yeah.
Olympiads were actually a great exposure because we were doing all those calculations and then would have to go to UCT for like competitions and stuff. And then there were also like some high school girls that inspired me when I came in grade 10. And then I'm still good friends with one of them as well. They were in the top 10 and they were also Christians. I was like, oh, they're so inspirational. So now I was in contact with one of them. And then
Mm.
I followed, like I kept in contact with her. And then she also went to UCT. And then
Oh,
from her statuses and everything, and also communicating with her, she would tell me about UCT and all of that. So I had a bit of knowing about what's happening at UCT before
did
I even
she study
went there.
med-
Did I?
did she also study medicine?
No, she studied a BSc in anatomy and physiology, if I'm not mistaken. So close to medicine. Yeah,
Wow, smart
yeah,
people.
yeah,
Smart people.
yeah,
Wow,
yeah.
man.
So in terms of the transitioning,
Mm.
yeah, it was a difficult one. It was
Mm.
really a
Sorry.
difficult one. So in high school, I was also part of the top 10. And I think a lot of people have told similar stories. You know,
Mm.
you're part of the top 10, you're there at the top. Yeah, all you know is academic excellence. All you know is your books and all of that. And then you come to UCT and then you start getting 50%. You're like, ah,
So
what is this now?
it is true. And you're no longer that student, you're no longer praised like there are people better than you
Yo,
there.
so that I'm also one of those people. Yeah, and I think yeah, a lot of people speak about heartbreaks, but
Mm.
yeah, academic
That was
failure
hard.
was one of my heartbreaks. In
Uh,
university because I remember because in high school I was in the top 10, right? And I remember um I cried for the first time when I didn't do well in IT because I didn't have a laptop. So I was struggling with practicing for the exams and all of that. And then first semester, I got a code 7. That was fine.
Yeah.
Then second semester, remember the work is piling up now, and then I'm just using the textbook. And then with IT, you have to code to
Yeah.
actually practice what you're doing. And
Mm.
then that time I got a 65%. Yo,
And you
I
cried.
broke.
And
I
you cried.
cried. That was in high school. I got a 65% for the
Do
first
you
time in my life,
are
and
you are
I cried. I was so
you aware that
heartbroken.
there are people who actually celebrate that mark?
Exactly. So now imagine crying because of that. Academic heartbreak is the worst. So now imagine I'm this girl that's crying because of a 65%, but I never got 65 again though. I made sure because yeah, I
Yeah.
was not happy with that. Then the other semesters or terms were code 6 or code 7, which was fine. Then now I get to varsity and then you get a 50%.
And you must celebrate.
Oh,
51 is a distinction.
so that was a shocker to me. And yeah, and then also what I realized, because I was that academic girl where I'm like, I sit down with my books, I study with my books, and then now the transition was that in med school you can't do it alone. And
Mm.
then one of the struggles which I was not aware of is that you actually need a mentor, even if it's not like someone who's like literally your mentor, but you need to be in contact with someone who's like senior. If you're a first year, you must be in contact with second year or third year. Then they can actually tell you what actually works. Because now for me, I was coming with that mindset that, I passed my grade 12 well and my high school years well using these study methods, which was studying my books by myself, and going through past papers and all of those things. But I was more of like sit down with your books and study with your books. And now I come here, I struggled. I remember one of the stories I tell was that when I struggled with failure was finding out that there are past papers that people were using, and I wasn't even aware of those, and I didn't have those, and people were passing. Are like, guys, what do you mean it was in the past paper? When you come out of an exam and you're like, what were they asking there? And then people are like, yeah, this was in the past paper. So I
Yo.
struggled. I didn't have the resources. I didn't have the
Mm.
correct people. So I think one of the things that I struggled with transitioning is not being in contact with people who are senior than I am, and
Mm.
also like surrounding myself with med school people. So I was more of friends with people that I went to. There's a student Christian organization that I was part of. So like those were like my friends and all of that. So now when I look back and I reflect, yes, we are still good friends and stuff. But I think also in your first year and going up, you also need friends that are on the same path that you are in, so that even if you're studying or you don't know something, then you can call a friend. So I think my first to second year, the struggle was that of not having people that are on the same journey that I am. Yes, like would sit in class together and all of that, but no one was like close, and I didn't have anyone who was senior to say, actually, to pass first year, this is what you must do and this is what you must not do, and these are the resources that you must use, these are the things that work. So I think my advice even to someone who's new in your degree, get someone who's senior, who's doing the same course.
Mm.
Don't have like a mentor that's outside. They can mentor you for other things, but you also need someone who's on the same academic journey, because they know the struggles, they know what works, they know what doesn't work, they know how the exams went. But other people who are not on the same, they will advise you based on their own experience, but you need someone who's had the experience of what you are going through.
Oh, beautiful. That's very
Yeah.
beautiful. So when you speak of seniors, you must like find somebody who's like, if you're doing your first year, you must find somebody who's doing like their second or third years.
Yes,
And
yes.
how do you get those people?
So, I don't know about other varsities, but
Mm,
at UCT we have what we call mentorship programs.
mm.
So basically, during orientation, you get assigned to a mentor, and then those people
Oh,
must follow up with you and stuff.
right.
But we're assigned to someone, I'm not going to name and shame, but they did that part of the orientation and disappeared.
Ah,
So, so yeah, I think, yeah, if you are brave, if you're one of those brave people, when you see people on campus, you can tell who's new and who's,
mm,
who's also still a fresher. So even if you approach them and you're like, "Hi, I'm a first year student. I need someone to guide me, in this
mm.
academic journey." But then if your university also has those mentorship program, that mentor that you are assigned to, because they've chosen to be a mentor, just bombard them with questions, bombard them with a demand of resources, because that's what they are supposed to do. They are supposed to be your mentors for first year.
Oh, okay.
Yes.
So I want
So,
to ask, sorry, I also wanted to ask about that because
mm,
um, it's either I thought maybe there are those who like ask you to pay them or like maybe demand payment or maybe they'll say no,
mm.
I can't do that. So they're actually assigned to they have to do that.
Yes, they actually apply for it at UCT. So there's a group of mentors that are first year mentors. So like during orientation, you get shown around and all of that, and they are specifically mentors for first years.
Uh
So yeah, and I do they get paid? No, I don't think they get paid.
they just do it
Yeah. Yes, they do it, and then it gets recognized as part of a leadership skill that you have
mm,
or you
oh,
had in university.
beautiful.
Yeah, that's how it works in the at UCT in the Faculty of Health Science.
Yeah.
Yeah,
So how I wish I knew this information before I got into university. Don't worry, we have
yeah,
the information. That's why we're
yeah.
here.
To do that.
So, what really, really inspired you to study medicine? Was it a thing to
Mm,
say, I'm smart, let me just be a doctor? Or maybe the teachers in
mm,
high school like, hey, you are very smart, you must be a doctor, you must be an engineer, you must be that. Or maybe
mm.
something that really inspired you.
Yeah, yeah. So I don't have a deep story. I know people are always deep,
Oh,
my sister was sick and this.
so I
I
how
don't
many
have a deep story. So
uh,
actually, I remember the first time I was asked what I wanted to be. I think it was in grade 6, and I had no clue. The first thing that came out of my mouth was, "I want to be a president." And then
what?
later I found out that I have zero interest in politics. So it wasn't gonna work out.
Why why was that the first thing? Was it the money or you just wanted to be a leader?
I think I honestly don't know. I don't know. I think the word president just sounded nice. I don't
You just
know.
wanted to
I
be like
honestly don't know. I was in grade 6. I was young, and then the
mm,
teacher was just going around in the classroom asking each person what they want to be. So it
mm,
was like a spot on thing. Yeah, but in terms of what inspired me, it's my aunt. My aunt is a nurse, so
ah,
she saw my maths, and she was like, "Yoni, you are so good in maths and physics as well," but she specifically said, "You are so good in maths, you would like make a good doctor." Yeah,
ah,
yeah, and then from there I was like, "Oh, okay." And I am good in maths, and I like maths. Like I loved maths. Like it was my favorite subject. So I was like, "Okay, if that's the way to go, let's go for it." But then as time went by, I think what kept me going even through the challenges, because I could have, changed the courses, because my thing was maths. my thing was maths. I enjoy maths. I like numbers. Yeah. But I think what kept me going is my passion for people. I think I love helping people in different ways. Like, it doesn't
Mm,
have to be in the hospital. So I think that is what has kept me going in the degree, that compassion and love of helping people. Yeah, I think for me, yeah, that is the
oh, that
inspiration.
yeah, very very beautiful. So,
Yeah.
as a person who loved, or should I say, love math, uh,
Mm.
do you think that if you were given a grade 12 paper now, would you still get the same mark or above 50%?
Definitely above 50, but I don't know about an A. Because it's been long ago now.
Uh, uh,
It's been long ago. Maybe
okay.
in algebra, I would get maybe 65 and above. Because
Oh yeah,
algebra, I feel like algebra is easy. Then
I
there's that geometry.
I
Geometry one is the tricky one.
it's very I love algebra. Like ish when I teach
Algebra made
algebra,
sense.
I just pardon?
I'm saying algebra made sense.
Yeah, like
Mm,
it's beautiful. When I teach the kids, I'm sure they also see that this guy loves this
mm,
algebra. We need more doctors who will treat patients with empathy and compassion. Yeah,
definitely.
that's true. So,
Mm.
what are some of the challenges that you have encountered so far, and how did you manage to overcome them?
In terms of med
Let's
school or working or
yeah, let's try both. Let's start with
okay,
UCT, and then we'll go to
yeah,
yeah.
yeah. So I think number one, I think failure. Yeah,
Mm,
I think failure was one of the challenges that I encountered for the first time in med school. And then I didn't know how to deal with it. And I think also the struggle was also that the people around me didn't know how to deal with it because
mm,
everyone knows
mm,
Uyonela, is this excellent person, now what happened?
uh,
Yeah, I think that was the struggle because the people around me, they also, yeah, they didn't know how to support me because they know this version of me. And then now when I encounter failure, and then they also don't know because they always, like celebrating, hey, you did well. Yeah.
so
Yeah, and also
we're
my
basically
dad was,
they were basically looking up to you,
yes.
and
Yeah.
then
And also,
when you fail,
hmm?
you let it down.
I wouldn't necessarily say let everybody down. Yeah, I
Uh,
don't think in that sense. I think it was just a more of we don't know what to say to you.
oh shame,
Yeah,
yeah.
I think it was more in that sense because everyone is like used to saying, you did well, it's
Mm.
A's and all of that. Yeah, and also it was that thing of academic validation is a thing where you're like, if you push, you're gonna get validated. And now it's like, okay, when no one has
Mm.
nothing to say, what then?
So, since actually it seems like you always aim to get high marks, like you always have it,
Yes.
right?
Yeah.
So, outside of work, do you think that you are going to be a strict mother because you are smart or you are smart? Are
I
you,
don't know.
hey, this is not what I'm paying for. I need you to get 80 or 85. Hey, for you to get that, you must get 90%. Do you think you're gonna do that, or maybe just gonna appreciate what they'll be actually doing?
I think I am soft, but I don't know. I feel like we'll see motherhood when we get there. But I think I wouldn't be that parent that's like, hey, why didn't you do this? I will also like
Uh,
support them, but also like encourage them that, you know what, you can do more than this. You are capable
okay.
of more.
So,
So yeah, instead of just saying, hi, this is not what I'm paying for. Yeah, I think I will be on the more medium, not low and be
Mm.
like, oh, my child, it's fine. No. But
Ah,
also like not like harsh, harsh. So I would think I would be on the soft with a bit of encouragement and saying, you can push more and do more and actually like get the help that they need if they need more tutoring, additional of what's being taught at school, then support them that way. Yeah. But we'll see
so
that when we get there.
where you get
Yeah.
as a doctor, don't you think like you're gonna expect them to do more? You'd be like, okay, I'm a doctor. I want you to be that. I want you to be that. Like, aren't you going to say, since your mother is a doctor, I wouldn't expect you to be that or to do that? Like something below that. I want you to be better.
No, they must do better. They must do better. We are
Right.
paving the way, Mos.
Right.
We are paving the way, but I'm definitely not going to be that mother that says, I'm a doctor, you must also be a doctor. But in whatever that's your passion, just excel in that. Yeah, I think I will be more of your passion and the vision. What's the vision? And, excel in that. Yeah.
So since
Yeah.
you like you had math and science in high school, so you're basically
Mm.
telling me gonna force them to do that. They can choose whatever stream they want to choose.
No, I don't think I will force them, but I will
Mm.
also guide them. I will have to hear where is this gonna take you?
The way I think like
Yeah, I will
okay,
also have to sit down and okay, explain, get my idea.
yeah,
Where is this
I'm
gonna take you? And
yeah.
what's the plan? Because
Fair.
there's a lot of careers out there now. Yeah.
Mm. So you're basically gonna say, I'm not saying you shouldn't do that, but what I'm literally saying is, if you did this, you'd get this, but you can do what you want. So you're gonna like give them more encouragement on what you want them to do, and then what you don't want them to, you be like, okay, not that, because
Yeah, I think I will be more guiding than saying,
I
do
don't want.
this.
Uh,
Yeah, because even in med school, there are people that critique that will like, nah, this didn't work. So,
uh,
yeah, rather than forcing people, yeah,
so
yeah.
workplace challenges.
Yes. So I was saying in varsity it was failure.
They,
And yes, and I want to share this because a lot of people don't know. Yeah,
mm,
but I did fail second year. So I had to repeat second year. So that was the heartbreak that happened in
uh, uh,
varsity. So my degree ended up being 7 years instead of
mm,
the 6 years.
6.
And also, what was also stressful and also like heartbreaking was that at UCT they have what we call a competency score, if I can put it like that. But in
Mm,
second year, people can explain this, people who know, but in second year, medicine, UCT, to pass, you must get a 65%. And because of that competency thing that they do, the
mm.
65% is your raw mark. And then that 65% equates to a 50% for that hub course. So if your raw mark is 65, on your transcript is going to reflect as a 50%.
What?
So, yeah. So the failure was difficult to accept in that you see
Mm,
your raw mark that this was more than 50, but then if it's a 64 it's gonna reflect as a failure because 65% gets converted to a 50%. So that's one
oh,
of the things that happened, and they want you to also like know your stuff. So that's what
mm,
happened in second year in that hub course that I was doing. I think I got like 59% or something as a raw
mm.
mark. That course was difficult. It was honestly difficult. Everything was new, and I said I didn't have resources and people to guide me on how to prepare for exams and all of that.
What
So,
was
someone says they call it adjustment. I don't know if they still do it because I remember during COVID, then they removed that. But it's been a thing in UCT second year, the hub course. They have a competency score thing that they do where marks are changed. And that factor thing that they do, the closer you are to 100, the less the reduction is.
So
So,
what was the course about? The
so
module?
it's
Is it a module?
basically,
Is
yes,
it
it's
like all?
basically hub. It's more of introduction to like medicine. So it's
Mm,
everything, your basic sciences, your virology, your microbiology,
mm.
everything. So everything was new. It wasn't the life science that you knew at high school. It was totally different. New words, new vocabulary. Yeah,
Yeah.
so it was just a lot of things. It's basically the core of medicine. Yeah,
Mm,
because as time goes by, you get to realize how everything reflects from that.
uh,
So that was the course. Yeah, and then the way that I managed to overcome that, yeah, at least I didn't fall into depression. The way I managed to overcome that was through prayer, honestly, because I remember I was so zealous. I was part of a student Christian organization there. I remember vividly the prayer that I made. I said, God, the same zeal that I have when it comes to your work and your things in the church, I need that zeal for my academics. And I feel
beautiful.
like that prayer changed my life because I realized how now I was more intentional about, my academics because I was like the same zeal that I have, God, when it comes to your work, when it comes to serving and all of that. I need that same zeal for my academics. Because when you are in varsity, a lot of things happen. Like academic pressure is a lot. You get stressed. There's submissions and all of those things to a point that sometimes you will neglect that actually all your life should glorify God. So I can't be out there preaching, but hey, this brother and this beloved is failing dismally.
Wow. So you are teaching us something. So you are literally saying you should know what to say when you pray.
Mm,
Beautiful. That's wonderful. So
yeah.
you must know what to say when you pray.
Yeah. So that helped. And then also I started becoming more intentional because now I started asking for help. I
Mm,
started reaching out as well to people and
mm.
say, and you realize people are so plugged. People have resources. People
Yes.
know people. And when you are here struggling alone. So I think the way I overcame also was to also reach out to other people and actually get the resources because while my marks actually changed, they actually
Mm,
changed when I now started getting the resources. And then some of the things when you write the test, you're like, oh, this was in the past paper and all of that,
mm,
instead of just trying and sitting down with the whole textbook and then stuff comes out in the exams that you don't know about. So, yeah. And then
but
the workplace.
the
Hmm?
workplace. No, I was about to
Yeah.
say,
Yeah, I think, oh my word, the workplace is people. Yeah.
do they? I don't know. So when before you help a patient, do you tell them that I'm still a student or maybe I'm new and all that? And if
Mm.
you say, do they like take you for granted or ask for your senior and stuff like that? Do they do that?
So yes, yeah, patients do that. Some will be like, especially with me, if you've seen me in real life, I'm very slim. So they always assume so they
Yeah,
always
but
assume
they don't know that what's in here it's not slim. What's in here is not slim. This is not slim. And you wouldn't be there if this was slim. They must
yeah, so I think yeah, so if you're a student, you are taught in medical school, you must introduce yourself as a student and say, I'm Yonela Gamnca, I'm a final year medical student, so that when the patient gets examined and assessed by you, then they know that there's still a senior that's and everything.
Oh,
Then now for us, since we are junior doctors, you can say you are Dr. So and so, and then you say you will also be reviewed by a senior as well, because now we are basically working doctors, but also like we do things under supervision. But also if it's like manageable things, yeah, I think the transition from final year to a doctor is that now you have responsibility. So you're not just like, I don't know this, I'll speak to a senior. You must act. If a patient comes in, whatever, it's a step chest or step in the brain or whatever, you must do something and then call the senior while you're actively doing
sorry.
something.
Oh, sorry. So if you don't know what to do. Like, do you show them, tell, or you act like you know, do something, and then go call your senior?
Um, how, for example, just repeat the question.
Like, let's say they are in pain, right? But they can't
Mm,
explain what pain is exactly, or maybe what the problem
mm,
is, right?
yeah.
So you're trying to find out what the problem might be, but you're not
Mm,
getting anything. So you tell them
mm,
that, hey, telling me I think I don't know yet, or maybe I have
mm.
no clue of what to do right now. Let me go call someone. Or you just basically start helping them, acting like you know, and then call your senior.
No, you don't act like you know. Yeah, I think
Yeah.
with medicine, it's structured, ne? That's why I say there's a lot of preparation that happens when you are a student before you enter the workplace. So, for example, when you see a patient, unless they are like unstable, then you can't take
Mm,
a history. The first thing you do is you take a history. After taking a history, you do your medical exam. Then you make an assessment. Then even when you make an assessment, it's not always like it's this. It's always a thing of, we call it a differential diagnosis, which
mm.
means what you're experiencing can be due to this or due to this or due to this. And then the plan now will be to do the tests that are involved or scans that need to be done to actually rule out the other things that it could possibly be. So even when you see a patient, it's not always, unless it's like obvious things. If a patient was stabbed, then you know it's a stab chest or whatever. For
Sorry,
or if it's like,
speaking of that, please, please tell us how you actually deal with that. Are you also not like afraid of blood?
no, I feel like if you were afraid of blood, you would have
You
finished
wouldn't be.
in med school. You
Oh,
can't be working now and you tell us you're afraid of blood. No, my
okay.
dear.
Please, please take us through that. The second part, or maybe if somebody was shot, how do you deal with that? Please, take us through that one.
So for that one, every case is like different.
Mm,
And yeah, for us, for some people, that's why like you must do like an initial assessment. Like I
mm,
said, for example, if someone comes in, it's a gunshot wound, you're not
mm,
gonna take like full history because the patient
mm.
is not, maybe not even able to talk. So
Yeah.
what you will do, you will do your ABCs or your CAB, check circulation, airway breathing, or airway breathing circulation. So you
Sorry,
do the
Dr. Gamnca, we are not doctors. When you say ABC, obviously I'm going to think about the alphabet, and I don't know what that stands for. I don't even know what that method is.
So, okay, so for an unstable patient, you would
Yes.
want to look at those things, which is your airway. Is the airway intact? Are they
Okay, so
speaking?
A is airway. Okay.
Yes,
Mm,
yes. It's
okay.
not apples, it's airway.
Oh, it's that's a good pun.
So your airway is the patient. Yeah. Is there any foreign object that you need to remove or whatever? So you checking the airway. Okay. Then if
Uh,
there's anything that you find there, yeah. If you there's a foreign object, you remove that.
mm,
If there's secretions, you suction that so that the secretions come out and not prevent the patient from not breathing well. And then B is your breathing. You listen
Oh,
and all of that. Yeah, and check if it's I can't go into a lot of things, but then you must check if it's a stirb, is the blood, is the air in the lungs, and all of those things, and then your
it's
circulation,
fine.
which refers
So
to your heart and all of that.
if you want,
Yeah, then you
sorry,
resuscitate the patient.
it's fine. You can talk about everything. If you want to talk about the bronchi or the alveoli, tell
But you'll
us.
be confused.
No, well, not necessarily me, but okay.
Mm,
Yeah, I'm not a medical.
yeah, yeah,
Okay.
but that's basically your unstable patient.
Mm,
And also with that, no,
mm,
it's always a thing of when you assess the patient, you also, especially if it's an emergency, you want to know, has the patient arrested? Do you need to start CPR, or it's a patient that is breathing? So if you do that initial assessment and you see there's no, your circulation refers to your heart rate
mm,
and blood pressures and everything. So if you can feel that there's no pulse
mm,
and the patient is not breathing, then you start with CPR, which is
mm,
now your compressions. You get there,
mm.
and we do this in real life, guys. I know people when they watch the movies, it looks cute and like medical, but it's exhausting. Yeah,
They they just do it
it
twice,
is
like 1, 2, and then
exhausting.
you wake up.
It is exhausting. Like literally, I need to start building muscle.
Yes, that's what I wanted to talk about. So doctors, so as a doctor, you must also go to the gym, right? So that you can have like
You
bicep.
must.
Yeah.
Because wow, and look at me, how small I am, and then
Mm.
a big patient, because patients have different BMIs now. And then you are there and you're like, you
Sorry.
sweat, you
So
sweat. It's not as cute as it looks in the movies. It's not
so
cute at all.
don't the male doctors say, you know what, it's fine, doctor. Let me do it. I'm strong.
No, they do. We take turns because that's how
Uh,
exhausting it is. So
mm,
when you do a resuscitation, there
mm,
must be someone who's leading the resus. There must be someone who's standing and looking at what everyone is doing and
mm.
actually giving out instructions. Otherwise, people are gonna get lost in the
Oh,
resus in terms of what is done and what is not done. So there must be someone that's saying, so and so, Dr. So and so, can you please start chest compressions? Dr. So and so, can you please bag the patient? So as you are
oh,
doing the chest compressions, there must be someone that's giving oxygen. Then there must be someone that's putting up a drip, and that is
oh,
very difficult when it's a few people that are there. Someone must be putting up a drip and taking blood to do a blood gas and starting fluids, and then other things as well, where you assess now, you check what can be corrected in the now. So that's your CPR. Then if it's a patient that is coming in and they, even if they're not talking, but at least there's a heart rate and the
mm,
patient is breathing, then you start to investigate. Then you start to examine your patient and do the relevant investigations. So it always depends on how the patient presents. Then if it's a patient that is stable and speaking, then you start with the history, because the history is very helpful in terms of guiding your diagnosis and actually finding out what can be the problem. So it will be your history, then you examine the patient, then you do your blood tests, and so your plan will be to do whatever blood tests that you need to do, and you start doing those. And also, if you're pressed for time and it's critical, then you can start with the important things that you were taught to do in medical school, and then you ask a senior to come and review the patient with you. So when you are unsure, you must, well, not always that you must, but you can speak to the patient and say, I'm going to discuss the plan with the senior to decide on what will be the final decision in terms of what we will do. Or you can say, this is the plan that I've made as the doctor. And then a senior will come and review you. And if anything changes in the plan, if they add anything or remove anything, then I will also let you know. So it's always important to be truthful to the patient. Yeah. And then also, if it's things that you can't do alone, then you say, we're going to wait for a senior to do this procedure. Yeah.
Oh, okay. So like, do you sometimes feel like, ish, you know what? I'm tired. I don't want to work. There's nothing going on anyway. Let me just go home when you're on call. Do you like have to be at the hospital, or maybe when you're on call, you stay at home? When there's something, they'll just like literally phone you and then you drive there quickly.
So, what also people must know, there are levels in this thing, hey?
Yeah.
There are literally levels in this thing.
Mm,
So, to break it down simply,
mm,
there's interns, which is
mm,
us fresh from
mm,
med school.
mm.
Then, so you after you, it's actually a long way to climb up the ladder. So after you're
Sorry.
done
So
with your 6 years,
how long how so you now you are a qualified doctor, but you are still
yes,
an intern.
yes, I'm not a specialist yet.
Okay.
Yes.
Okay. So
So
how long does it take you to like go up there?
yeah, it also depends on what you want to specialize in.
Mm,
So you finish med school, then it's 2 years of internship.
mm,
Internship meaning you work as a junior doctor with supervision. Then there's ComServe, and then in ComServe, you're more of a senior doctor. You usually get placed like in rural hospitals and all of that to be the most senior doctor there.
mm,
Then after that, you are a medical officer. And then depending on you, you can then choose to be a chronic MO, meaning you will spend the rest of your life just being a medical officer, meaning you've done your 9 years of training, you can work independently, but
mm,
then you are not a specialist. And then you can work being an MO the for however long that you want, or you can be a chronic MO. Some people are chronic MOs, or if you have a special interest in a department, then you work there, but you are not a specialist.
mm,
Then after being an MO, you can then choose to specialize. And then depending on what you want to specialize in, it depends on how many years. It can be 3 or 4 years or 5 years. Yeah, I don't know all the details, but the years differ depending on the specialty that you want to specialize in. And then when you are training to be a specialist, you are called a registrar. So meaning you are not an MO, you are not an intern, you're not a ComServe, you're more senior. Then now you
yeah,
can after you're done with being a registrar, meaning
yeah.
you've written your exams and all of that,
Mm.
then you can become a consultant. Then that's when now you can speak about, chilling at home and you get cold.
So
So you don't just stay at home. So for
so if,
us, if you're doing a 24-hour call, and it's 24-hour by name, because
mm,
if you started from 7, you don't leave at 7 the next day.
it's
You
possible
do the work that
I
needs
know.
to be done. So it's like close to 26, 28 hours or 30 hours, depending on the hospital that you are in. So when you're on call and it's 24 hours, you're literally there the morning until the next day. You're in hospital, seeing patients, working the whole time. So that's how exhausting calls are.
Mm.
Yeah.
So is it do you always have to use this or this?
So the stethoscope, you have to use it. Yeah, 30 hours sometimes, and it's not nice. You will be there. You're literally wearing the clothes that you were wearing from yesterday. And you know what's also annoying is when you post call and then they want to do an academic round. Then they start asking you questions and you're like, my brain cannot think now.
So,
I know we need to be taught, but you are tired. Like you are tired. You are burned out. So yeah, those are some of the challenges that we unfortunately have to go through. Yeah, that's why I'm like, when I get to heaven, and I'm sure other doctors are saying the same thing. We want to see the person who invented calls. If that person is in heaven, Prof. Because colds are so unhealthy. Yes.
uh,
So where was I now? What were you asking again?
the stethoscope. Do you always have to use the stethoscope?
So when you see a patient, you must always fully examine the patient. But then sometimes it's busy, and then you examine just based on the presenting complaint. So if a patient comes in complaining of stomach aches or whatnot or abdominal mass, then you focus on that. Or if a patient comes in with stroke, one side is not working, then you focus on that. But medical legally, you must examine the patient fully, because even if a patient can come with, let's make an example. Well, a toothache is like a toothache. You say a dentist for that. But just an example, a patient comes in with a toothache, then you realize that on examination, then you find other things that the patient did not mention. So you must always examine. And then also the reason why you also carry stethoscope is that you never know when an emergency will occur. You never know when a patient in the ward will arrest, and then you are called, and then you must actually start CPR. And to do that, you must actually listen as the heartbeat coming back, the heart, the lung sounds coming back. Is there a good air entry? Even when you are begging using the mask or the oxygen or whatever, you must check if the patient had to be intubated, to actually even check if the tube is actually in the right position. It hasn't gone to one lung. Then you must check that there's air entry bilaterally and all of that. So you must always carry it, because there's no scheduled emergencies. And when you are called, at least you have something that will help. So yeah, but medical legally, patients must be fully examined, even if that doesn't always happen because of time constraints and having few doctors and all of that. Yeah.
So, right. Okay. Now I get it. I
Mm-hmm.
get So, as a doctor, do doctors have a good relationship with nurses, or you guys just say, you know what, no, we are doctors, they are nurses. I don't think they will understand our language, or maybe we're not doing the same thing, you know? Do they like form their own group, and doctors also form their own group? You guys just like work together when you have to. There's no such thing as, okay, now we're having lunch. Oh, there's a nurse sitting there. Let me go say hi, let's talk and all that. Do you like talk to them? Do you engage? Do you form relations and stuff like that?
Yeah, I think we can form. There's no rule that, your doctor, you're a nurse, you separate. The
Mm,
actual thing is that I think if everyone could have this mindset, things would even be so much better, instead of people fighting against people and all of that. If
mm,
everyone would always remember and know that our main work is that we are there for the patients.
mm,
So if we all had that effort, and knowing that the nurse, whatever role she or he is doing it for the patient. And
mm,
I, as a doctor, whatever I'm doing, it's for the patient, it's to benefit the patient. Then the relationships could be
mm,
more better. But yeah, I think, yeah, we can form good relationships, but I think it's just that thing of, the different schedules, and also the work that we do, that we do this work as doctors, and then the nurses, these are their roles. So sometimes even the schedule clashes to say, you know, let me go and chill with
Mm.
them and all of that. But
Oh.
we work together. We see each other in the wards. You get to know people, yeah, and you greet. And then also, even we also have what we call ward rounds, which is
Mm.
basically where a team of doctors and also a nurse must be present as well. We do like
Mm.
rounds, and then we speak about the patient, and then the nurses say on their side if they have any issues or what they've noted
Mm.
um, during the night or during the day when they saw the patient. And then we also say, as doctors on our side, this is a plan, so that when we are not there and the nurse is there, they are aware of what the plan was about this patient. So we never see, a patient is never seen individually, like by
Mm.
just one doctor. It will be a doctor, it will be a nurse, it will be, yeah, well, it's especially for things, well, in all the departments basically. So it will be the doctors, it will be the nurses, and if a patient needs a rehab, which is your physio, your OT, your speech, and all of that, they also see the patient. Your dietitian, they see the patient. So we all work together for the benefit of the patient.
Oh,
Yeah.
beautiful. Okay, so
Mm.
there's a superior or inferior. You're all doing it for the patient.
Yes.
Okay.
Yeah.
So when we started, I asked something about, you know, when a patient loses their life in your hands. So
Mm.
you also need to explain something, but I don't think you got the chance to.
Yeah.
So how do you deliver the bad, or should I say the sad news? And what do you do when they start blaming you? Because I know people get emotional, right? They'll say,
Mm.
yeah, it's because you're a junior doctor. Oh, you didn't do enough. But then we're here for like 5 hours. If you helped us, maybe, stuff like
Mm.
that. How do
Yeah.
you deal? How do you deal with such words when because I don't,
Mm.
they get a little bit rude, I know.
Mm.
Yeah.
Yeah. I think also what has worked for me is
Mm.
that understanding that people grieve differently.
Mm.
So I think if you have that understanding, and then
Mm.
you break bad news to family members, you must don't have an expectation of how they're going to react.
Mm.
So just don't have an expectation. And then, so the way that you do it, as taught in med school,
Mm.
is that you must take the family members to a separate and quiet room.
Mm.
Yeah, that's ideal. It doesn't always happen because different hospitals and whatnot. But if resources are available, you take the family members to a separate room, then you tell them, you don't just go straight that da 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 passed away. You tell
Mm.
them, you take them through the process, and you tell them that unfortunately we do not have good news. And then there's that WPC mnemonic that we use, which is you warn, you pause, you check. Okay.
Mm.
So basically, now when you tell them that unfortunately I don't have good news, you are actually, warning them that, something has happened and you
Something.
don't want
Yeah.
this. Yes,
Mm.
so that they are mentally prepared and all of that. Then you pause, you allow the silence, and then you tell them, so and so passed away. And then you check, and then you explain, this is the diagnosis, or this is the differentials we're working on. Sometimes patients pass away before we actually reach the final
Yeah.
diagnosis of what this actually is. So then you tell them, we think what has led to the death is this. And then you explain to them, and then you explain, this is what we did, this is what we were planning to do if there were
Mm.
things that were not yet done before the patient passed away. And then, yeah, and then you break truthfully to them like that, and you tell them, at this time the patient passed away, was there a resuscitation done or not done, and yeah, all of that. And then you explain from now what's going to happen. The patient will be taken to the mortuary, or if they need anything religious that they need to do, then they also inform you. Then you check with them, do they have any questions? And if there's things that you don't know, then you also tell them that I'm not sure about this. If you want, you can also speak to a senior who can, speak to you if what what I'm saying to you is you're not fully 100% convinced
Mm.
about it. Then the senior will also come. Yeah, but most patients actually accept the news, and I think what also helps is that management of patient while they're in hospital, and constantly, well, not every day, but giving family members the update that this is the update with the patient. The prognosis is poor. We don't think she or he's gonna make it. Yeah, so I think that also helps, because now if the family members were not aware of what's happening to their family member, and then the next day they come, the patient has passed away, then it's going to be a shock. Then they're going to be angry. But if
Mm. Mm.
us as doctors, we were updating the family members and saying, this is what's happening now, this is what's new, this is what we've added, and this is what we've stopped, then then the family members are not in the dark. Then when it happens, it's actually not like a shocker to them, because if a patient complicates, then we also call the family members to say, unfortunately, your family members is not looking much better as we hoped, but this is what we're going to do further. And then they also come and see the patients and all of that. Yeah. Then
Yeah.
you must always check with the family members. Are they following? Is there anything they don't understand? Is there anything they want to ask that's unclear, and all of that? Yeah.
So you talked about taking them to um,
A
a
separate
special
quiet room.
or separate quiet room. So what if it was like an instant thing? The person was shot, or maybe it was a car accident. They were involved in a car accident. So you're literally helping the patient inside. Obviously, without them, they're waiting outside.
Mm,
And then, obviously, when you walk out, they will
mm,
expect instant results. What if you say,
mm,
can we please go and talk there and there? But then they say, no, we want to hear the news right now. What happened? Is
mm,
our friend okay? Are they alive? Stuff like that. What
mm.
if they don't want to go to that room? What do you do? You deliver the news there?
Yeah, sometimes you deliver the news there,
Mm.
especially in some of our settings, because there's also emergencies in the hospital where it's like casualty. Everyone is there. Everyone who comes in emergency gets in there. Sometimes there's literally no privacy there. Like you
Mm.
will put on the curtains, or those, I don't know what you call it, but there's those curtains that you can move around that have a
Mm.
wheel just to cover the patient. So sometimes, because as a family member, you will be concerned, what's happening. And we've also had some multiple cases where I've also been involved in a recess where, like, we told the family members, just stay outside, but then they literally there peeping through. And
Oh,
then they can see as we are on top, and
yes.
like we can't stop a recess now to say, go away. We'll
Mm.
just continue with what we're doing, and then cover with curtains and all of that. So now they could see that the doctors were busy on top of the patient and all of that. And unfortunately, if it's a failed recess, then we have to, cover the patient.
Mm.
That unfortunately they've passed away. Then as you come out from there, the team amongst ourselves, whoever's there, then if we know that the family is literally standing outside, then we'll decide, one senior doctor or whoever can say, yeah, I will inform the family of the bad news. And then as you come out of the curtain, then you tell them, if it's like in that instant that unfortunately so and so didn't make it. We tried to recess, but it was too late. Yeah,
So I,
because sometimes also people bring people that have already passed away in the hospital. Then they
uh,
rush them there. and the patient comes already. Yeah.
Oh, so they're they're not accepting that this person
Yeah.
do something.
Yeah, I think it's always that hope when they realize no, and then they're like, let's rush. Okay, so and so's not
Ish.
breathing. Let's rush to the hospital. I
Mm,
remember there was a mom that brought a child
mm,
to the hospital because she was concerned. And the security saw the child and was like, Mama, your baby's not alive.
ish.
Imagine as the
Yeah,
mom entered and the security is like, no, this
ish.
baby is already. So there are some cases like that, but you also don't blame them because it's always a thing of, I'm looking for help. Yeah,
Yeah, and
yeah.
it's not easy, hey, to accept that
Mm,
more.
yeah,
Yeah,
yeah.
they always want to prove that, hey, you know what I'm thinking maybe is true, you know?
Mm, yeah,
Mm, okay.
yeah.
So you are allowed to deliver the news alone. Aren't you afraid that they might slap you or start misbehaving there and there's nobody to help you, or maybe the security is always around?
The security is not always around. Yeah, I don't know. I've never been afraid that they're gonna slap me or
Mm,
whatnot.
mm.
But there has been a case where I was like, "Yo, I know, mama." She literally, she literally beat
Right.
me, and I was like, "Oh my word!" And
Uh,
then at least her family was there, but it was like one of the old people. I think it was. That's why I was like for me, it also came to that realization of you need to understand that people grieve differently. So
mm,
now, yeah, and I think for that, for that case, it was also heartbreaking as well because I think it was during visiting hours.
mm.
No one had noticed in the wards that the patient had actually passed away. So
Uh,
when the family now came at 3 p.m. and they were trying to talk to the patient, and also that's the thing that especially in big hospital, there's not like 24-hour supervision where it's like someone is staring at you
mm,
on your
mm,
face, the nurses there and all of that. So I think the nurses missed it. And also with us as the doctors, we're done with the round and the ward work and everything. So unfortunately, yeah, that patient was missed. And then when they came now um, at 3 p.m. during visiting hours, yeah, then I think they noticed that no, they talking to the person, but the person is not responding, and they could see the eyes were like staring, not moving, not blinking. So then the nurse was called, and then the nurse assessed the patient, and then now as a doctor you get called in if maybe you were in a different ward, and then I was the doctor that was called because I was covering that day. Then I went and then I assessed the patient, and then the family was there now because it's visiting hours. So they were literally there, and then the
mm.
nurse did inform me that the family is here, this is what has happened and all of that. Then I did tell them that I'm Dr. So and so, I've been called by the nurses, I'm just going to assess the patient. And then I assess the patient, no pulse, no breath sounds, no heart sounds, the patient has demised. And then because they were literally there behind the curtain, I had to break the bad news to them at that time that, as you saw, it indeed is true. This patient has demised. And then the granny, I don't know if she was the parent of the patient that had passed away. So now when I said the news, yo, she beat me. She was like, hi, cause a woman. She
Yeah.
was, I think for
Uh,
me, it wasn't a thing of, hi, but why are you beating me up? I didn't do anything. And also for her, it wasn't a thing of, like I'm blaming you. It was just that disbelief, and
yeah.
also I think the way that they found out, it was a shocker to them. So even the family members who were there, they also stopped her and were like, "No, Mama, stop what you're doing." Da da da.
Oh,
So they
shame.
could understand. So people grieve differently. So that was one of my experiences. When I left, I was like, because I didn't shout at her, but I was like, "Yo, my shoulder."
Now I must
Yeah.
go see a doctor as a doctor. So yeah, but it's actually so sad because
Mm,
the way they found out,
mm.
I think with if it was like a different
Set
family
up.
would have, yeah, they would have
Yeah.
assumed that, oh, maybe they were not taking care of
Yeah.
brother, sister. Why did we
Yeah.
find like this? If they were checked,
Yes.
would have
Yeah.
known, you know. But it's
Yeah.
actually it's possible. You can literally do
Mm.
whatever you're doing, and then as you walk out, they,
Yeah.
you know.
Mm.
So yeah.
Yeah.
Last question. What can you say to somebody who's still in high school, somebody who wants to study medicine? What advice would you give them?
Mm. I think my advice, yeah, I think first of all, the warning shot, I would say that it's a lot of sacrifice.
Mm,
It's a lot of sacrifice. You must know that if you are in it, you are in it.
mm,
And the sacrifice doesn't start when you start working, it starts even when you are a student.
mm,
Because even as a student, you do calls as well.
mm,
So, especially when you are in your clinical years, it's
mm,
more like you are a working student
mm.
because you will get to do calls, meaning even after hours at 10 p.m. when other people are done with their courses and schoolwork, you
Yeah.
are in the hospital when working unpaid. You are literally working unpaid.
Mm,
And then you also get to do calls on weekends as well. So even your Saturdays, your Sundays, you will unfortunately have to sacrifice because sometimes you'll be required to be in the hospital.
mm,
And also even the duration, especially for people who are family orientated and
mm,
family lovers, unless you stay at home with your family, but also the course of the year. It's also different from other degrees as well because we start like early in Jan. Some I know in some courses some people start like in February and
mm.
all of that.
Or even
And yeah, or even March. So if you're a person that wants, to stay at home for 3 months with family, it's not gonna work. That will not work. And then you will even end the year later. Sometimes you end the year in December, you see, and you've been there in January. So some people, started only in March and then they go home. And then you
October.
are still in res. You're still studying. Yeah.
Mm,
So even when it's exam season, sometimes it's exam season, especially at UCT, we have different campuses. That's the med school campus and there's upper campus. So upper campus people will be having exams, and when your exams are like in 2 weeks time, you're still attending classes and all of that, so your schedule will be very different, especially also if you have friends that are not doing medicine. So
mm.
sometimes you'll miss out on a lot of things where you're like, people are like, let's gather this Saturday, and you're like, you're on call. Sometimes on Sunday, you wish you can go to church, but you are on call.
Ish.
So it's a lot of
Mm,
sacrifice, and also that balance of being tired from being at the hospital 24 hours, and then you still have exams coming and you still
mm,
have assignments that you need to submit and all of those things. So it does really take a toll on your mental health as well. So you must also take very good care of your mental health. If you need to see a therapist or yeah, a psychologist, do that. And also at UCT, there's student wellness where if you are unwell, you can go there, physically unwell or even psychologically unwell, and then find those things that actually work for you. If jogging works for you, if going to church, if prayer works for you, if reading books works for you. Yeah, I think the other important thing is to find something that's meaningful to you outside of medicine, because medicine will literally take all of your time, because like they tell you at first year that it's lifelong learning. The learning never stops, because even with medication, there's new things being invented, even with research, everything is constantly being updated and all of that. So you must keep up to date so that you manage patients accordingly and using updated guidelines. So yeah, that's what I would say. Yeah, be prepared to sacrifice, and yeah, I think go for it if it's really something you love, because otherwise, yeah, you will get exhausted and quit. And then the other thing I would say is that you need to mentally prepare yourself, because most doctors are not nice doctors.
Ah,
Yeah. Yeah, I think that's one thing I wanted to say with the challenges in the workplace.
so
Um,
the seniors,
yeah.
they know that you're still a junior, you know, they know they
Yeah.
and you, so
Yeah, some people become impatient even with teaching you, and also even just the work environment itself. It can be so toxic where you
mm,
feel so belittled.
ish,
Where during ward rounds, people who know ward rounds can be toxic, where you are told you are stupid if you
ish.
don't know a question, and you are told you are stupid during, maybe 20 people, because it's, like I said, there's levels. It's
Mm,
what
mm,
rounds will
mm,
consist of your consultants, your registrars,
mm.
your MOs, your interns, and your students, because you also have students as well. So such things that can even cause people to go into depression, where you feel like, I'm trying and studying hard, but then there's just no way you can know everything. And also sometimes you would have read something but you forgot, but
Mm.
now it looks like you don't know anything, and then people look down on you and all of those things. So I think also be prepared that sometimes the work environment can be toxic, and also sometimes there's also what we call compassion fatigue,
Mm.
where I look at doctors and I'm like, people are exhausted, and I'm like, I don't know, if you're so exhausted, you can, well, it's a hard decision, but you can quit, but don't be such a rude doctor who doesn't care about patients. Come on.
Yeah.
I
So,
think those are some of the challenges in the workplace, where you just see like, hey, well, this doctor doesn't care.
yeah, you have to have that heart. I feel like, well, it's a good thing that you are actually encouraging people to prepare
Mm,
themselves for
yeah,
people who are going
yeah.
through. But overall, under
Mm,
one umbrella, let me say that I just feel like it's not okay to be rude, regardless of your.
not.
You always need to be kind. You know,
Yeah.
you know that I know better than this person, but don't
Mm,
you best to share the knowledge so that when you
yeah.
retire, you can say, you know what, I've helped that one. You don't have to tell us, but then you
Mm,
act from the goodness of your heart.
yeah.
You need to help people and say, you know what, I want to see you doing better than me tomorrow. I want you to do that, to do that.
Yeah.
As much as they
Yeah.
think junior doctors don't know as much as they know, obviously you're not going to
Mm,
have that experience in like a,
yeah.
right? But then
Mm,
groom them, like help them. You never, they might be junior doctors, but they will help you tomorrow as well. You don't know
you know,
you have,
exactly.
you don't know everything. You don't.
Yeah. Yeah. So
All
literally,
right.
sometimes
So
you feel like you could tell people that you were also a junior at some point. You were
yeah,
also a student. Come on.
and I feel like also it is because they also experienced something, you know. So they
Yes.
also to, you know, make you feel the pain. They're like, okay,
Mm,
I also,
yeah.
for you to
Yeah.
be strong, I must also go through that. And not everybody
Yes.
needs that kind of sharpening. I don't think so.
Yeah.
Right.
And then I think the last thing would be, I would advise, especially med students. Well, I think
Mm.
in general, do job shadowing.
Sorry, let's, well, in general, but then let's talk about, please help the grade 12s now, because they are
Mm,
writing their exams for, so for sure they want to know the target, the marks, the APS,
mm,
what they need to do to study medicine at UCT.
mm. Yeah.
Mm,
So I think I think the last thing I wanted to say before I answer the question is that another important thing is that you must do job shadowing. I think that will give you like a lot of exposure, especially when you are still in high school. Do as much job shadowing as you can so that you can actually see what's actually happening in the field that you want to go to, because it's not glamorous as people make it seem to be.
Yeah, when
It's not
like,
as cute
ooh,
as,
yeah.
yeah, and medicine has bad smells, guys. That's one thing I'm also like, growing in, I'm like,
Yeah.
let me keep a straight face, but this smells so bad. So, yeah, I think one advice that I would also say is high school students do job shadowing. Go to the clinics, go to the hospitals, and actually see what it entails being a doctor before you even make that final decision, because there's opportunities now. Don't be, yeah, you mustn't be all shocked when you now start to, be in varsity and you actually doing the course, then everything is a surprise. Well,
Mm,
some things will be a surprise because definitely the experience is always different from what you are told, but at least have some insight before you get to choose the degree that you want to do. Yeah.
that's wonderful. I think
Mm.
I once advised people to do that. You must do job shadowing,
Mm.
better, because there you'll be able to like talk to those people. They'll tell you what they did,
Yes.
everything.
Yes. First hand.
Mm.
Yeah.
Unlike Google everything, because I mean,
Yes.
yeah.
Nah. Yeah.
All right. Well,
Yes. And then your question?
yeah, no, that was, you have answered it. I just wanted, oh,
Okay.
you didn't, no, 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 sorry. The APS, the marks that they need to actually
Yes.
in high school, grade 12, and the APS for medicine.
Yes. So I don't have the current what do you call
APS,
the current yes, the current
okay.
print of
Or maybe
what's the,
yeah,
yes. But I remember what I can say is that always aim for more than what's written there. Because I
like,
remember when I was applying, which was back then in 2017,
mm,
um, they said maths 65%, your
mm,
physics 65%. And
mm.
I tell you, the people that are applying there, everyone has more than 65%. You are
Yeah,
applying with people who have passed with 90s and
yes,
80s. And then now it's going to be a frustration to you if you
mm,
now have, let's say you have your 68% in maths and
yes,
then you don't get in, but you're like, this is what they say are the required admission scores or admission points that you should get.
so they,
But always aim for more than what's written there,
mm.
because what's written there doesn't guarantee you that you will get in. Yeah, I
Oh,
think that will be the advice that I will give, because it always depends on the people that are applying, how many people are applying, and also the marks that they are getting. So, for example, the people that are shown on TV, you will be applying with those people, and then when you have your 68%, so that is just the reality.
uh,
Yeah, so that's why my advice would be look at what's there, but aim for more than that.
yeah, you need to aim
Yeah,
higher.
yeah.
Okay. Well,
Mm.
that was a beautiful one, very productive, insightful.
Mm.
So, thank you so much.
Thank you so much. This was
I know that
refreshing.
you're very busy, but you tried to avail yourself. So, I truly, truly
Mm.
appreciate
Thank you so much for having me. I truly
it.
enjoy this.
Me too. Me too. That was very
Yeah,
productive. Yeah, and
yeah.